One of the most important results of our study was that we found PEM to be an acceptable alternative to MRI. And we know that many women have trouble with MRI for various reasons, either claustrophobia or if they have a pacemaker or metal implant of various types. And having an alternative to find additional cancer before the patient is treated for her breast cancer is actually very important. In the past, many studies have looked at MRI. It's a very sensitive test. It does show us additional cancer in a high percentage of patients who have it, but it's problematic because it will sometimes find additional lesions that are not cancer. And it's been shown in several recent papers that it actually does not reduce the rate of positive margins, and it does not actually reduce probably the rate of recurrence even. And so it's controversial. And meanwhile, many of these women will end up with unnecessary biopsies and even sometimes unnecessary mastectomy because of findings that were suspicious on the MRI. And so one of the goals of our study was to determine whether PEM might actually be more specific, in other words, less likely to prompt an unnecessary biopsy or even unnecessary mastectomy. And we were able to show that PEM is, in fact, less likely to prompt these adverse events. Two-thirds of the biopsies that were prompted by PEM showed cancer, compared to only about 50% of those prompted by MRI. And that's a significant improvement in specificity.